This talk is about the refractory and supernormal periods. It is intended for the clinical neurophysiology fellows at Nicklaus Children's Hospital. Quite a few years ago, we could say many years ago, an article was published on this subject. Since scattered articles on the refractory and supernormal periods have appeared in the literature, yet this technique have not become mainstream because it is time-consuming, lacks standardization, and the normal limits are not well established. The reason I include this talk is because you will often find questions on the boards mentioning the refractory period and the supernormal period, and also because they are good to review basic neurophysiological principles. The bulk of this presentation is based on Dr. A. Arturo Lei's work published in Levine and Luther's book. This talk will be conducted in a question and answer format. The first question is, which of the following studies is the most useful to determine the refractory period? A. Pair stimuli. B. Train of stimuli. C. Collision studies. B. All of the above. The refractory period can be studied in nerves and muscles. In nerves, all three nerve conduction study modalities can be studied. The tests used to study the refractory period are paired stimuli. This test can study motor, sensory, mixed nerves, and muscles. Train of stimuli. This test can be used to study mixed nerves. And collision studies. Collision studies can be used to evaluate motor fibers. Of all these tests, pair stimuli using mixed nerve is the most useful clinically, but is still only used on rare occasions. Train of stimuli is based on the pathological nerve dropping in amplitude and increasing in latency at lower rate of stimulation than healthy one. These tests are painful since rate of 100 to 200 are needed to demonstrate changes or to document their absence of changes. They will not be discussed any further in this talk. So the answer to this question is A. Next question. The positive after potential phase occurs before the negative after potential phase. A true, B false. An action potential provoked by excitatory postsynaptic potentials looks different in myelinated neurons depending if they arise from the initial segment or from the nodes of Ranvier. Those from the initial segment have an initial hump due to the summation of excitatory postsynaptic potentials, whereas those from the node of Ranvier lack a hump. This figure represents an idealized experimentally triggered initial segment action potential. Looking at voltage in relation to time. The lower dashed line represents the resting membrane potential. The one above, threshold. And the third line indicates voltage reversal. The regions under the R represent rest potentials. between the R regions we see the action potential. The phases of an action potential are 4. The first one comes after the initial R, and it is called the slow depolarization phase. It results from the added of excitatory potentials at the initial segment. The second phase occurs after the slow depolarization phase. It is called the quick depolarization phase. The third one, coming after quick depolarization phase, is called Repolarization phase. As this phase ends in the area close to the asterisk I just placed in this frame, the segment of action potential that I have color yellow between the threshold and the resting potential, you find a segment called the negative after potential. Two things are odd about this labeling: negative and after potential. The reason for these oddities are that these terms were borrowed from the terminology used to label intracellular action potentials recordings. The nitty-gritty about the labeling oddities were addressed in the physiology talk, so I will not discuss them any further in this talk. The last phase, phase 4, is called the positive after potential. So the answer to this question is B. Next question. During an action potential, there are two periods of excitability above the resting state excitability. A true, B false. I have now introduced a graph to trace the propensity of excitability of the membrane in relation to time. The dashed line indicates the virgin threshold of the fiber in question. The segment of a fiber that at a given time is said to have an excitability above 100% would require a lower intensity stimulus to produce an action potential than when the same segment has an excitability of less than 100%. I have now introduced a tracing that reflects the excitability status at different times in the course of an action potential, specifically of the action potential I presented to you before. The R's I have just introduced stand for resting membrane potential, as they did before. They bracket the action potential. The action potential we previously described, based on the degree of excitability, can be divided in 5 periods. The first period, which I label A, is the initial supernormal period. The implication of using the word supernormal is that the stimulus lower than one that triggered the initial action potential from the resting state can trigger a second potential. Notice that at this time the aqua line is above the 100% line. The next excitability period, which I have labeled B, is called the absolute refractory period. During this period, no stimulus, regardless of intensity, can trigger a second action potential. So the excitability of the membrane during this period is 0. The third period, which I have labeled C, corresponds to the relative refractory period. During this period, an stimulus can trigger a second action potential, but it has to be stronger than the stimulus capable of producing the action potential from the resting state. So, the membrane excitability during this period is not 0%, but it is less than 100%. The fourth period, here labeled D, corresponds to the late supernormal period. During this period, a stimulus lower than the one used to produce the initial action potential from the resting state can trigger a second action potential. The fifth and last period, here labeled E, is called the subnormal period. During this period, a stimulus, in order to trigger an action potential, has to be stronger than the stimulus that triggered the first action potential from the rest membrane state. So during this period, excitability is less than 100%. So the answer to this question is A. Next question. A nerve segment undergoing DASH is most likely to generate a second action potential with a low intensity stimulus. A. Local excitation and negative after potential. B. Local excitation and positive after potential. C. Quick depolarization. C. Rest and local excitatory potentials. This figure is the one we have just explained. I will now bring back the action potential figure to correlate it with the excitability chart. You can see them together in this frame. As you can see, highlighted by red color, the slow depolarization phase of the action potential occurring in the membrane patch undergoing local excitation corresponds to the initial supernormal period of excitability. The next area highlighted in red is the quick depolarization phase of the action potential that corresponds to the absolute refractory period in the excitability chart. The next red area is the repolarization phase of the action potential, which corresponds to two excitability periods, the relative refractory period and the late supernormal period. Next, the positive after potential phase of the action potential corresponds to the subnormal period of excitability. So the answer to this question is A. Next question. Which of the following conditions is not linked to a prolonged relative refractory period? A. Multiple sclerosis. B. Carpal tunnel syndrome. C. Hypokalemia. D. Guillain-Barré syndrome. This abstract from a paper published in 2004 lists conditions associated with prolonged refractory period. The author indicates that refractory period prolongation is a marker of axonal dysfunction, either related to primary axonal injury or secondary to axonal injury due to myelin malfunctioning. Conditions associated with prolonged of the refractory period include alcohol, diabetes, and toxic neuropathies. Guillain-Barré syndrome, carpal tunnel syndrome, and multiple sclerosis. The association with multiple sclerosis is interesting since it implies peripheral nerve involvement in this condition known to produce central nervous system pathology. So the answer to this question is C. Next question. The first step in determining the refractory period is triggering an action potential and documenting its threshold. A true, B false. So the first step to determine the refractory period is to provoke an action potential and record the threshold of the segment of the axon in which the action potential was triggered. This is usually presented in a diagram fashion representing millivolts in the y-axis, and the green line represents in this frame the level of voltage reversal, as you can see. Time is represented in the x-axis. Now I am representing the response to a local stimulus by a dashed brown line. Since this intensity of the stimulus did not trigger an action potential, the response will fade much within the same time course as it appeared. Now, if you give a second stimulus after the life of the prior stimulus has extinguished, but this time the stimulus is a little bit stronger, you may trigger an action potential, as in this example. Thus, we have established the configuration of the first action potential and, more importantly, the threshold. The threshold can be defined for practical purposes as the voltage above which the voltage-gated sodium channels open, producing an action potential spike. This threshold will be labeled virgin threshold because it represents the threshold of the first of the pair of potentials done in each trial while conducting a pair stimuli study. So the answer to this question is A. Next question. The second step in determining the refractory period requires multiple trials, each consisting of a pair of stimuli. A true, B false. So we know that the first step is to provoke an action potential and record the threshold of the segment of the axon in which the action potential was triggered. The second step is to establish the threshold of the same segment of the axon to a second stimulus at different intervals in relation to the action potential triggered by the first stimulus. So let's start. This step takes many trials, usually about 10 trials, in order to determine the absolute and relative refractory periods. The first trial consists of giving a second stimulus at about 0.5 milliseconds after the stimulus that triggered the initial action potential. The stimulus should be stronger, that is, the second stimulus should be stronger than the one given to obtain the first action potential. The choice of a stronger stimulus is the product of prior experiments demonstrating that stimulus of the same intensity as the first one never are effective triggering a second action potential at the designated time. So the stimulus is given, but as we previously mentioned, of higher intensity. In the scenario that I have created, this stimulus produces no potentials. During the second trial, after the first action potential is obtained, a second stimulus is given. This stimulus again is of higher intensity than the second stimulus used in trial number 1, but it is given at the same time as the first stimulus was given, that is at 0.5 milliseconds after the first stimulus was given. The second stimulus in this trial did not trigger an action potential, as you can see in this frame. During the third trial, after the first stimulus to produce the first action potential at about 0.7 milliseconds after, a medium-sized stimulus is given, hoping to produce an action potential. But in this created scenario, no action potential was triggered. During the fourth trial, again after the initial action potential is triggered, a second stronger stimulus is given at the same time than the prior trial, that is at 0.7 milliseconds after the first stimulus. And again, no action potential occurred. During the fifth trial, at about 1.5 milliseconds after the first stimulus is given, a second small stimulus is given, which produce no action potentials, as you can see in this frame. During the sixth trial, a medium intensity stimulus is given at the same time as the one in the prior trial. And again, this stimulus did not produce an action potential. During the seventh trial, the timing of the second stimulus is not changed, but the intensity of the stimulus is increased. And at this point, an action potential is triggered. During the eighth trial, after the first stimulus, a second low-intensity stimulus is given shortly after 2 seconds of the first one, that is of the first stimulus, and again, no action potential is triggered. During the ninth trial, after the initial stimulus is provided, the second stimulus is given at the same time as in the prior trial, but the stimulus is stronger. And in this situation, an action potential will occur. During the 10th trial, after the initial stimulus, a second stimulus is given using an intensity similar to the stimulus that triggered the initial action potential, but doing so 3.5 milliseconds after the first stimulus was triggered. And so an action potential will occur with the same morphology as the one we saw with the first stimulation. So the answer to this question is A. Next question. Which of the following characterizes the relative refractory period? A. Stimulus to excite an axon needs to be higher than normal. B. Action potentials are of lower amplitude. C. Conduction velocity is decreased. D. All of the above. In this chart, I have incorporated all the significant trials we have introduced individually in the process of answering the last question. Now, I have placed a dot at the last stimulus that did not produce an action potential, and subsequent dots at the points the stimulus was capable of triggering an action potential. Now I have drawn a line joining them. The line traces the threshold of the fibers being studied in relation to time. This threshold line reflects the status of the membrane potential produced by the initial action potential. Thus, in this case, the refractory period was 3.5 milliseconds. This time corresponded to the period of time it took for the stimulus of the same intensity as the stimulus that triggered the first action potential to again trigger a second action potential with the same characteristics as the initial one. The refractory period is followed by a period of normal excitability. The refractory period can be further divided into two segments. The first segment, called the absolute refractory period, that in this case lasted about 1 milliseconds. During this period, no action potential will be triggered regardless of the intensity of the stimulus. The absolute refractory period is followed by a second period, here represented as a yellow line, which is called the relative refractory period. In this case, the relative refractory period lasted 3.5 milliseconds. During the relative refractory period, a stimulus of sufficient intensity can trigger an action potential, but it will be of lower amplitude and longer duration. This period ends when the amplitude and the latency of the action potentials triggered during it become the same as the amplitude and the latitude of the action potential provoked by the initial stimulus. Notice that the first action potential triggered by the second stimulation is smaller and wider than the one present in the next trial, and that the one present in this trial is smaller and wider than the one in the last trial corresponding to the end of the refractory period. It is also important to notice that during the absolute refractory period there is no conduction through the segment involved in the process, and that during the relative refractory period conduction through the patch of axon involved will be slow. So the answer to this question is D. Next question. Axonal refractoriness influences maximal firing rate and direction of conduction. A true, B false. The absolute refractory period prevents any backspread of the action potential. The refractory period also determines the maximal rate of discharge of an axon. Thinner axons that as such have a longer refractory period have a slower firing rate. Then, thicker axons with shorter refractory periods can discharge faster than thinner axons. So the answer to this question is A. Next question. The causes of relative refractory period are residual inactivation of sodium voltage channels and the presence of open potassium voltage channels. A true, B false. The causes of refractory period vary according if the refractory period is absolute or relative. During the absolute refractory period, the primary cause is that voltage-gated sodium channels are open, and that those that are not open are inactive. During the relative refractory period, the primary cause for lack of reactivity is that voltage-gated potassium channels are open, and the second reason is that some voltage-gated sodium channels are still inactive. So the answer to this question is A. Next question. Median nerve orthodromic absolute refractory period usually lasts until dash milliseconds after an initial stimulus. A. 0.7 to 1. B. 70 to 100. C. 100 to 700. D. 0.1 to 0.2. In clinical practice, the median nerve orthodromic absolute refractory period can be determined by stimulating the index fingers and recording from the wrist. The activity thus produced will travel as indicated by the green arrow. 8 trials or more are usually needed to determine the absolute refractory period by pair stimuli. All the stimulus used during these trials are supramaximal, implying that a 20% increase in intensity above the intensity of the stimulus that recruited all fibers should be applied. The first trial consists of stimulating the index finger at time 0. Notice that the stopwatch measured in fraction of milliseconds, that the divisions are set at 20 microvolts and 1 millisecond. Now the first trial starts with a stimulus, which I have replicated as a vertical aqua line for better vision. A traveling wave will therefore be recorded, which I have also replicated as an aqua wave. The latency to this wave is 2.98 milliseconds in this example. Now we go back to the stop clock to indicate the time of the second stimulus. Notice that the clock indicates 0.1 millisecond. Thus, 0.1 millisecond becomes the stimulus interval. At this point, a second stimulus is applied, which I have incorporated to the figure as a vertical magenta line. The question mark that I have just placed indicates that no potential is generated by the later stimulus. Now we go to the second trial. The parameters are the same. The first stimulus triggered during the second trial produces a wave with the same characteristics as the initial wave in the prior trial. Now look at the stopwatch again. See that now it is indicating the time for the second trial, that is 0.2 milliseconds. As indicated, corresponding to the level in the interstimulus interval column, here pointed by the arrow. This stimulus again is represented in this frame as a thickening of the initial white line and as a magenta vertical line. Again, the stimulus failed to produce a wave. Now we go to the third trial. The parameters are unchanged. The first stimulus is given at time 0, as it is done for the initiation of each trial. Now, looking back at the stopwatch to indicate the time for the second stimulus, which in this trial is going to be 0.3 milliseconds after the first, as reflected under the inter-stimulus interval column. And I have incorporated in this frame. As you can see, the new vertical line corresponds to the second stimulus. Notice the progressive separation of the magenta line from the aqua line, representing the progressive increase in the inter-stimulus intervals. Again, after the second stimulus, no potential is triggered. Now we go to the fourth trial. The parameters remain unchanged, and the first stimulus produces a potential with similar characteristics of amplitude and latency as the prior one. Now let's look at the stopwatch, indicating that the timing for the second stimulus is 0.4 milliseconds. Again, as you can see, this is reflected on the right side of the frame. And again, no potential is triggered. Then comes the fifth trial. Parameters and responses are the same for the first stimulus as in prior trials. Looking back to the stopwatch, as you can see, the second stimulus is given at 0.5 milliseconds after the first. Notice the changes in the stimulus activity and the presence of a magenta line, both indicating the changes produced by the stimulus. Yet again, no wave is produced by this stimulus. We move to the sixth trial. Parameters and responses for the first stimulus remain the same, but the second stimulus, now given at 0.6 milliseconds, as you can see, is incorporated on the right side of the frame, and again it produces no potential. Now we come to the seventh trial. Parameters and responses of the first stimulus are the same. The second stimulus is now given at 0.7 milliseconds after the first, but now a small wave is present in the tracing as indicated by the arrow, and schematically reproduced as a magenta wave. Notice that the amplitude is only 8 microvolts, where the associated wave triggered by the first stimulus is 20 microvolts. Also notice that the peak latency is 4.40 milliseconds, as indicated by the arrow, whereas the peak latency of the wave produced by the first stimulus remains 2.98, as it has been from the beginning. Now we go to the eighth trial. The first stimulus parameters and results are unchanged. The second stimulus, given 0.8 milliseconds after the first, produces a second potential of a slightly shorter latency and higher amplitude. Thus, the absolute refractory period ended with the appearance of the first potential produced by the second stimulus, which corresponded to 0.7 milliseconds after the wave produced by the first stimulus. So the answer to this question is A. Next question. The relative refractory period is more sensitive than routine measures of nerve conduction in the detection of axonal disorders influencing nerve conduction. A true, B false. Here, the question is the duration of the relative refractory period. The criteria to determine the end of the relative refractory period is when the wave produced by the second stimulus has the same amplitude and peak latency as the wave produced by the first stimulus. Some authors use only one of the two criteria, either latency or amplitude, because at times they do not tend to coincide. So, in this case, the duration of the relative refractory period obtained by subtracting the duration of the absolute refractory period from the number at the end of the relative refractory period was 2.28. Some authors believe that the first indication of neuropathy is detected by this test, that is, by demonstrating evidence of prolonged relative refractory period earlier than by doing regular nerve conduction studies. So the answer to this question is A. Next question. If a potential traveling orthodromically collides with a potential traveling antidromically, they both disappear. A true, B false. This drawing from Dr. Kimura depicts an action potential occurring after axillar stimulation producing an M wave. This added figure portrays an M wave due to wrist stimulation. The axilla M wave does not occur because the orthodromic conducted potential triggered from the axilla is blocked by the antidromic potential generated at the wrist. As you can see in this frame, the arrows are going towards each other. Above, the yellow cylinder representing a nerve fiber. The arrows are now getting closer. They represent the approximation of the wave from the axilla to the wrist. Now they are colliding. The collision brings about the disappearance of the waves, but in addition, we find a complete block that corresponds with the absolute refractory period for a time. And a little later, the block becomes partial, corresponding to the relative refractory period, and finally the block disappears. And at that time, conduction through the segment is reestablished at a normal rate. So the answer to this question is A. Next question. Choose the end of the absolute refractory period in this motor nerve collision study. The study was done simulating the ulnar nerve and recording from the abductor digiti quinti. Please take a look at the study and decide which is the right answer, A, B, C, or D. This frame illustrates an ulnar nerve motor conduction study to the abductor digiti quinti with two stimulators, one at the wrist and the other one at the axilla. To the side, you see the result of different trials of three stimuli. One of the stimulus is from the wrist, two from the axilla. The wrist antidromic wave and the first axilla stimulus orthodromic wave are, in order to conduct this study, timed to collide at the elbow. The interstimuli interval establishes the time relation between the first and the second axillary stimuli and is given in milliseconds. I hope that in the next few frames, by visualizing these events, you can understand them better. So here you see the M wave from the wrist stimulation is always present. The M wave of each trial is indicated by being highlighted in green. The M wave from the second axillary stimulation is present only in some but not in other trials. They are highlighted in yellow. The interstimulus interval is presented for each trial. The starting time is represented by 0 in the stopwatch for the first trial. Here, the yellow thunder indicates the stimulation, and shortly after that, we see the wrist M wave. 6 milliseconds later, when the potential from the wrist has already traveled orthodromically and produced an M response, and the antidromic conduction is close to the elbow, the axillary stimulation is carried out. Thus, the first wave created. 1 second later, the proximally traveling wave from the wrist and the distally traveling wave from the first axillary stimulation collide. As this is going on, that is 1 second after the first stimulation in the axilla, a second axillary stimulation is carried out. While the collision with the disappearing of the just collided wave takes place, and about 1 second when the orthodromic stimulation from the second axillary stimulation reaches the elbow, the refractory period completely blocks the wave. That is, the wave created by the second stimulation coming from the axilla. Hence, the second wave or the second M wave will not be present. Now, we will look at the last trial in this example. As indicated by the arrow pointing to the bottom of the screen. Now you will see the wrist stimulation given. 6 milliseconds later, the first axillary stimulation is given. The wrist and axillary wave collide at the elbow, canceling each other out and producing a block. But the second axillary stimulation is now given 2 milliseconds after. Therefore, the orthodromic impulse, because at this time the absolute refractory period would have already passed, and therefore the orthodromic wave will travel all the way to producing a second M wave. You can see by looking at this frame that in the last stimulation, both the first M wave and the second M wave are present, and also that the M wave created by the prior trial is exactly the same as the one that we are seeing with the last trial. This frame shows the criteria used to define the duration of the absolute and relative refractory periods. The duration of the absolute refractory period consists of the time from the first axillary stimulus, in this example given, until the first of the second stimulus produce the second M wave. In our example, this corresponded to 1.2 milliseconds. Since it is the first time the stimulus of the second axillary stimulation gets through. The duration of the relative refractory period is obtained by subtracting the absolute refractory potential time from the time spent between the first axillary stimulus, in this case from the axilla, and the first of the second stimulus producing an M wave with consistent amplitude and latency. So the answer to this question is B. Next question. Please take a look at this frame and choose the end of the relative refractory period in this motor nerve collision study. You can choose A, B, C, or D. Stop the video and think about it for a little while before you choose, hopefully, the correct answer. The answer could be arrived at by remembering what we have just said, answering the prior question. And the answer is D. Next question. Which of the following is not true regarding the supernormal period? A. It starts 2.5 to 3.5 milliseconds after the initial stimulus. B. It has to be detected using submaximal stimulus for the second stimulus. C. The threshold goes back to normal in 10 to 20 milliseconds. C. It can be detected using supramaximal stimulations for the second stimulus only. This figure is from an article I showed you at the beginning of this talk. The drawing I did so to indicate the position of the electrodes. The cathode was placed at the wrist and the recording was done at the elbow. Thus, it was a mixed orthodromic conduction study of the median nerve. The first stimulus was supramaximal. The second stimulus were adjusted to be way over the usual supramaximal stimulation to determine the refractory period and to a submaximal level or a submaximal intensity to determine the supernormal period. In this new frame, the arrow points to the wave produced by the first supramaximal stimulation, and now to the wave recorded after the second supramaximal stimulation. Thus, the absolute refractory period was 0.6 milliseconds in this patient. That is the time when a potential first got through and was not blocked. Yet, as indicated in the graph I have just introduced from the same patient, the intensity of the stimulus required to produce a second wave at 0.6 milliseconds was 500 times more than the stimulus intensity it took to produce the initial wave. This pattern was consistent in the second, third, and fourth patient. These graphs are from the same paper. As you can see, the scale for the percentage is changed, and the time span in the x-axis starts at 3 milliseconds and goes on to 20 milliseconds. The area shaded green in this frame corresponds to the supernormal period in these patients. During it, less stimulus intensity was required to trigger a second wave than it was required to trigger the first wave. This period started at 2.5 to 3.5 milliseconds after the first stimulus and usually lasted for 10 to 20 milliseconds. It was maximal from 5 to 8 milliseconds after the distal stimulus. So the answer to this question is D. Next question. Subnormal period is characterized by all of the following except A. It starts right after the supernormal period. B. It lasts up to 200 milliseconds after the initial stimulus. C. It is maximal from 38 to 60 milliseconds after the initial stimulus. D. During it, only 50% above the initial stimulus intensity of stimulation triggers a wave. In this graph, this subnormal period can be clearly seen highlighted in red. During this period, only a stimulus stronger than the stimulus required to trigger the first potential will be able to trigger a potential. The subnormal period lasts up to 200 milliseconds and is maximal from 38 to 60 milliseconds after the initial stimulus. And the stimulus to be affected must be 5 to 13% stronger than the initial stimulus and not 50% as it is stated in the question. So the answer to this question is D. Thank you very much for your attention.